Is this a heart attack, a stroke, or a seizure? And what kind of first aid should you use? This is Claude Akins inviting you to watch and learn. Okay, Frank, I'm here to help you. First, compose yourself by taking a couple of deep breaths. Good. Now here's what I want you to do. You listening? Now look at your watch. We're going to need a few moments out of time. Seizures can be caused by a number of health conditions: diabetes, brain infections, heat exhaustion, pregnancy, poisoning, hypoglycemia, high fever, or head injury. In addition to these, about 1 person in 100 has recurring seizures known as epilepsy. Grand mal seizures are the ones which most people generally think of when they hear the word epilepsy. In this type of seizure, the person undergoes convulsions, which usually last from 2 to 5 minutes, with complete loss of consciousness and muscle spasms. Recognition of seizure disorders and knowledge of first aid is important because it's easy to mistake some seizures for some other condition. A grand mal seizure is a convulsion, but it may look like a heart attack, and CPR techniques may be used when they're not necessary. In a typical epileptic seizure, there is a sudden cry or fall or rigidity, followed by muscle jerks, shallow breathing, or temporarily suspended breathing, bluish skin, and the possible loss of bladder or bowel control. Usually the seizure lasts a couple of minutes, then normal breathing starts again. There may be some confusion and/or fatigue, followed by a return to full consciousness. And this is where you came in, Frank. First aid for seizures is mostly a matter of preventing the victim from hurting himself. Keep calm and reassure other people who may be nearby. Clear the area around the seizure victim of anything hard or sharp. Put something flat and soft like a folded jacket under the victim's head to protect the head from injury. Do not try to force the seizure victim's mouth open with any hard implement or with your fingers. The seizure victim cannot swallow his or her tongue, but efforts to hold the tongue down can injure the victim's teeth or jaw. Don't try to hold the seizure victim down or try to stop his or her movements. Don't attempt CPR, except in the unlikely event that the seizure victim does not start breathing again after the seizure has stopped. Don't try to give liquids during or just after the seizure. Stay with the victim until the seizure ends naturally. When the seizure is over, loosen clothing or anything around the victim's neck that may make breathing difficult. Then turn the seizure victim gently onto his or her side. This will help keep the victim's airway clear in case of vomiting. How do you know if it's necessary to call for help? Do not call for an ambulance if medical ID, jewelry, or card says epilepsy, if the seizure ends in under 5 minutes, if consciousness returns without further incident, and if there are no signs of injury, physical distress, or pregnancy. Do call for an ambulance if the seizure happens in water, if there is no medical ID and no way of knowing whether seizure is caused by epilepsy, if the seizure victim is pregnant, injured, or diabetic, if the seizure continues for more than 5 minutes, if a second seizure starts shortly after the first one has ended, or if consciousness does not start to return after the shaking has stopped. As many as 80 to 85% of people with epilepsy can get complete control of their seizures as long as medication is taken regularly. Others may still have seizures but can be valuable employees when placed in the right job. For example, a person with a history of epilepsy may be disqualified from being a truck crane operator. The abilities and/or limitations of each worker with epilepsy should be considered individually. Through the study of first aid for seizures, you will be prepared to assist a co-worker wisely if he or she is stricken by a seizure. Also, you will be able to give other workers instructions on first aid for seizures and promote good safety attitudes among your co-workers. This is Claude Akins reminding you that safety is your job too.